high counts of LDL cholesterol are associated with cardiovascular disease. But it mostly depends on particle count, depends less on particle value. Well, they damage the endothelium. The endothelium is the most inner lining of the arteries or the arterial wall. There, they damage the artery's ability to generate nitric oxide, which helps to dilate the arteries. Next is high amounts of small, dense LDL. They increase cardiovascular disease risk by 3 to 4 times. That can be easily ordered on a blood test. Small, dense LDL. It's associated with metabolic syndrome. Also, it's associated with insulin resistance. But if you test and look at the size of the particles and find that the particles are numerous, then there's a discordance and there is actually risk, even though the volume measures relatively normal. Yes, but it also can be made worse if there's a lot of a protein called lipoprotein little a. If there's too many of these lipoprotein little a proteins attached to the LDL particle, having high LDL level volume or count. Now, LP little a is highly correlated or associated with our genetics, and it tends to be a relatively stubborn value to decrease. So this is a cholesterol particle that's typically part of a standard lipid panel also, and it also imparts pretty important risk to cardiovascular disease. This carries a lot of triglycerides. It's a precursor ultimately to LDL. It tends to promote damage to the arteries. Its benefits are reverse cholesterol transport, meaning it's binding and picking up and binding cholesterol in the tissues in the periphery and transporting it to the liver to be metabolized. It protects against the oxidation of LDL, which is a very bad thing. Additional good cholesterol or HDL benefits include providing immunity in the arterial system. So it helps to fight against pathogens, helps to keep viruses and other bad stuff out of our arteries. HDL is most protective at a value of about 60. A 2 to 3% risk drop can occur with every increase in HDL. So good, healthy HDL values are important.